Andrea Thomas is somebody who I often call upon when we are talking about mental health issues. She counsels in private practice, and the name of your counseling center is Peaks of Hope. Andrea, I want to talk about how this pandemic has really affected people, and while you've gotten busier these summer months than like normal summers, people aren't necessarily saying that COVID-19 is what's bringing them to you.
You know, people are not stating that specifically, but it's a factor. It's a factor in every person walking around in Rochester and in Minnesota, and it's something that we all have in common. But yeah, people are coming in, a lot of times have been struggling with whether it's anxiety or depressive symptoms from, maybe throughout their life at different points. But I think the difficulties that COVID-19 is bringing into people's lives definitely is bringing them into the office.
You know what I worry about is parents are under so much stress. I worry about the kids because I have been more tense at home. I've been a little bit shorter with my temper. I catch myself after I say something that I automatically regret. But there's a factor in that and how this is really affecting kids.
Absolutely. I think, since the COVID has come about in our environment daily, I know that I've had a number of, teenagers and even younger children that have been severely affected by, being isolated and not around others. And parents are also dealing with the struggle. And quite frankly, whatever happens with school coming up, that's going to put a lot of pressure on both the parents, the school, everyone. And trying to navigate that is going to be difficult ahead of this announcement that's coming from Minnesota. So, students can't be left out in the dark. Their development as teenagers is to be social, to be around people, to be, a lot of kids rely on sports and activities for their friend groups and activity and exercise, and that's right now not happening, and that makes it very difficult for teenagers to develop the way that they're meant to at this stage.
What is something that as a parent, we know the typical warning signs and what we're supposed to be looking out for, but if you were to talk to a parent right now listening to this, what would be something that you would tell them to specifically look for that we may not have heard before in dealing with a kid who, I don't want to say maybe suicidal, but maybe going into that anxiety, depression phase that we wouldn't recognize?
Well, I don't know if there's anything that you haven't heard before, but I think the most important piece with teenagers, and I have teenagers myself, so I know that, teenagers need their time, but teenagers cannot be isolated in their rooms on their devices. Parents that connect with their teenagers and have real conversations every day are going to be the parents that are more connected to what their teenagers are doing emotionally and recognizing when there's a change in their behavior, a change in the way that they're talking. Those are things that parents should really look out for. Change in friend groups, just the type of words and the type of shows and music and things that they're using and seeing. Those are, as parents, we just need to be in the life of our children. But as teenagers, it's really hard.
How do you get a teenager, an adolescent, a preteen into counseling when they say they absolutely will not go, but they need it?
I think, I've had a lot of parents that are in that boat, right? And what is helpful, what I've seen helpful for myself, and I know a lot of other counselors in the area, either we'll do a free phone consultation or a free office consultation or telehealth, whatever they're at right now. But I offer that free consultation. A lot of times parents come in and we talk about, what it might look like. And so the parents can get to know me, and then I can kind of give them an idea of, what I would do with their child. And then hopefully we can bridge the gap a little bit as far as, counseling isn't that, it's not scary. It's not weird. It's just, it can be natural. And I think, our students just have this stigma against talking to someone. And I would say most of the time when I can get a teenager into my office and just talk with them and chat with them and just hang out for that consultation, they come back.
They come back because they feel better. They've got someone who is listening to them without a judgment ear, somebody who is not going to reprimand them, and somebody who is truly just wanting to help them through whatever that is. I took my boys into a counselor because I knew that there was stuff that was bothering them, and they were reluctant, and they were very happy. They now ask to go back and see her because they know that they can get a lot off their chests.
Well, and I think it's important for parents to also make sure their teenagers know that a counselor is confidential. Like, I cannot talk to my clients' parents unless there's a safety issue. And I am very clear with that with my teenagers that, you know what, I'm not going to talk to your parents unless we have a conversation first. Even if there's a safety issue, we're going to talk before I talk to your parents about it. So making sure that that is a cornerstone, because they're really afraid of that. They don't want to share everything with their parents. And I think that's okay. And that's kind of where they're at, is developing their own identity.
Amen to that. Andrea, thank you so much for this. We'll put your contact information along with this interview on our website. I appreciate you as always and your time.
Thank you.
And there's a new number that people will be able to call soon for additional support on a national level. It is 988. Those three numbers might be able to save lives. The Federal Communications Commission will formally designate 988 as a nationwide three-digit number for mental health crisis and suicide prevention services. It's going to start in the year 2022. The two-year time frame gives the FCC time to address any technical issues and ensure proper nationwide implementation and to get it staffed. Local mental health groups locally agree with this decision. A couple of other numbers you can reach out to for help right now, for you or maybe someone you know.